Well, I'm here this morning. We're going to go ahead and get started. We've got a few people joining us. We're going to be recording this so you can watch it at a future time. I know the lighting's a little bad. We thought that we were going to get the sun out by now, but unfortunately, it hasn't hit yet. Can you guys hear us okay on there? If you can't, please let us know. I'm joined by my special guest and good friend for many, many years, Dr. Dennis Bassetti. We wanted to talk to you a little bit about COVID, ask him some questions, and get his expert advice. Dennis is a local physician. He's been here for about 75 years, I think, practicing medicine in Highlands County. You can see he's only 65, so that's been a little bit long. But I've known him since he took care of my grandmother back in the early 90s. So we've been friends for a really long time. I'm glad to have him on board. And Dr. Bassetti, how are you doing today?
Doing just fine.
And how's life in the medical community been the last few months?
Well, I can only speak for myself, and we've been basically open for business and seeing patients every single day. We haven't shut down. We haven't taken any or cut back seeing patients or taken any special precautions aside from hand washing and occasional masks. So it's been pretty busy.
Yeah, I know that some of the physicians out there have had a cut in patients coming in, some problems getting. Have you had any problems getting protective gear for your staff and in your office?
Initially, it was hard the first several weeks, but as the production facilities ramped up, we've been able to obtain whatever we've needed now. So
That's great.
It's all good.
And have you seen any cases come through your office?
I've seen no acute cases. I've seen several after the fact cases.
So someone tested positive and then they came in for a checkup or something?
Right, because I do antibody testing in my office, so I can document whether or not a previous viral illness was COVID or something else. So within about a 95% accuracy.
On the antibody test?
Yes.
Yeah, that's fantastic. So a question for you, there's been a lot of discussion online, especially in Highlands County forums with some of the commissioners as to whether or not testing is available in the county. So is testing currently available for the disease and the antibody testing?
Yeah, there's 2 or 3 types of testing. There's the acute testing of a nasal swab. And
that's the one where they put the 7-inch thing?
Yeah, it's no fun because I had it myself. And you can... That'll tell you whether you have an acute infection, also with a 95% accuracy rate. There's a latency between the day they collect the test and when you get the test results. There's a couple of companies that make these instant machines, and you can get a test result within about 2 hours. I don't think we have those in town yet. And then you have the after-the-fact test, which is an antibody test.
Right.
Which will detect whether or not you have antibodies against the virus, which means that you had the viral infection at some point in the past. I've had several people think they had the COVID virus because they had a very bad viral illness, and a lot of times maybe all but 2 weren't the COVID. And of course, the first case in Highlands County was March the 21st. There's a 2-week latency. So a lot of these people had severe viral illness first part of February, which antedated the first diagnosed viral case in Highlands County. So, but I had one guy who had symptoms, I think February the 15th, something like that. Retired paramedic, and he actually did have the coronavirus. So now he's immune.
And how long, you mentioned immunity, how long does that immunity last once we get? There's been a lot of discussion of that on the news that it might last 6 months, a year, 2 years.
You know, I'm not an expert. I'll give you a guess. And my guess is like any other viral immunity, it'll last your lifetime, but it wanes with age, like everything else. So I think that once you have immunity, you have immunity. Now, there have been a few cases where people have gotten the virus, gotten over it by the nasal swab, and then have tested again and had it again. So I don't know if that's a reinfection. I suppose it's possible. I guess you could be reinfected with anything, but it's not likely. I think probably that was just the initial infection, which hadn't totally been cleared. If you have a test that has a 5% false negative rate, if you test me today, I'm positive. You test me tomorrow, I'm negative. Maybe tomorrow would be the false negative test result, meaning I would have been tested had you tested me a 3rd time. There are a lot of vagaries. There's no test which is 100% accurate, which kind of throws things off. Of course, that's in medicine in general.
That's in general, right?
Yeah.
Yeah, again, I'm here with Dr. Dennis Bassetti in beautiful downtown Sebring, right out in front of the Strangely Warm Coffee Company. If you need a hot cup of joe, they're open from 7 to 9:30, Monday through Friday. Come on down. If you want to come down and see us, we're sitting right here on Ridgewood Drive. 1 block off the circle. So one of the things about the testing that I'm curious about is there was discussion just this weekend. Why can't I get a test? So if someone wanted to be, I have no symptoms, I'm healthy, and I want to be tested, is there a place I can go and just pay someone to get the test done?
Yeah, I do tests in my office, and I try and not test people whom I don't think have it. Now, a lot of times I'm not sure, so I might test just to be safe. But if you came in with nausea, no fever, no cough, no shortness of breath, I'd be less inclined to test you rather than if you came in with a fever, shortness of breath, or whatever. So it depends upon your symptom presentation. Tests are available. There was a deficient supply of tests, so they had to be very frugal, and they had to just test the person who would most likely test positive to get benefit from using the test. But now the tests are more readily available. So I can test anyone in my office. If they come in, we can test them. There are other places where you can get tests. The health department has a little bit stricter criteria, also because they don't have the staff. They're pretty busy, and also because of the expense of these tests.
Right. So you can get one. That's one of the big questions that everyone's been asking about. So that's great news to know that we can do that. Do you know what the total count is right now in the county?
80 something people, I think, are
about
positive.
80 positive tests.
Yeah, 7 or 8 deaths.
Yeah, 7 or 8 deaths.
You know, it's interesting. I had a patient in my office last week from Okeechobee, and I was kind of bragging to her. So, boy, we have it made here in Highlands County. We have 105,000 population or something like that. We've had only 80 cases, and we've had only 8 deaths. Not to downplay the loss of life. She said, well, in Okeechobee County, they have 100,000 people. They've only had 18 cases and no deaths.
Wow.
Yeah, so that prompted me to do a Facebook post comparing the cases of COVID versus population density, and there's almost a 1-to-1 relationship. The smaller the county, the lower the number of cases. When you get down to the larger counties like Broward, Dade, and Pinellas, the number of cases shoot off the chart. And I guess it's because they have a higher population density and increased disease transmission.
Yeah, and you actually do some medical research as well, and you've been posting a lot of really cool graphs and information on a regular basis about what's going on around the country. And one of the interesting things that I think we've really learned from this is that overall as a society, there's a big difference between our small rural counties and the impacts it has versus tightly densely populated urban areas like Miami-Dade, New York, other places around the country. So I think those numbers have been very interesting to follow, and you've done a great job of giving the information out to everyone.
Thank you.
Now, the antibody test, how is that actually administered?
Well, there's 2 ways you can do it. One is a finger prick, and that's a test that takes 10 minutes. You get a result. I should have brought one. I could have put it on your program here. It's a little pinprick. You put it in a little cassette with a couple of drops of reagents. Big noisy truck went by. A couple of drops of...
We tested the sound, and we thought that it was doing a pretty good job. I know that someone right across the street in their office is not working, and they're watching. Maybe he can wave at us and make sure the sound's okay. So finish a drop of blood in a cassette.
Yeah, then within 10 minutes, the blood will migrate up this little area, and you can detect whether or not they have antibodies. So it's pretty fast. That's one way. Another way is a standard blood antibody test where they would send your blood to a reference laboratory, test you, spin it down, and then they can actually tell you the level, the milligram per deciliter, or how much antibodies you actually have in your serum. So that's more accurate, and that'll actually give you an antibody level. This is a qualitative test, yes or no type of a test.
Yeah, that's good. Now they talked about some of the antibody testing. Thank you, Philip Statler, for coming out of his office to let us know that everything's okay. So there was some talk about the new test that they're doing at the on TV. I don't remember which one it was, but it was like a 5-minute COVID test. We're starting to get some light out here now too, so maybe I can spin and get a little bit of it on my face. Where they have these quick tests with a little machine where you don't have to do the swab down your nose anymore.
Yeah, you can do a saliva test, you can do a buccal or a mouth swab.
Now, are those all have similar accuracy rates? So that
there's so many tests out there, I don't know the difference between the two, but that's what I mentioned at the beginning. They have these little machines you can buy, but they're selling these machines to the larger facilities that have, you know, more cases than we do in Highlands County. So I tried to get two different companies that make these machines, 2 different machines, and they're not available yet. They'll be available after the epidemic is over, I'm sure.
Well, they'll be available maybe for the next time. Maybe they'll be on sale. It's like Christmas decorations.
Yeah.
So if you don't mind, I want to spend a little bit of time. There's a lot of talk on the news and a lot of talk locally about the way this virus spreads and personal protective gear for people that maybe we should, well, certainly telling us to wash our hands is something that I think we all should have been doing all along. But the different things like, should I wear, does it help me to wear gloves to go to the grocery store? Does it help me to wear a mask or different type of mask when I go to the grocery store or when I'm driving in my car?
You can do an experiment, or you can do a visual observation. You go to the grocery store and see people wear the gloves. They touch everything in the store. They touch their money, they touch their wallets. They push the cart out to their car, they unload the groceries with the gloves. They open the car door, they hop in the car door and get behind the steering wheel with the gloves on, so it totally defeats the purpose. So I think gloves are a waste. I think wash your hands frequently or use a hand sanitizer frequently, because you're lulled into a false sense that the gloves are going to protect you. And these people touch their nose with the gloves, so go figure. Now the mask will protect, I think, the person who's not using the mask more than the person who's using the mask, because the masks never fit properly. And if you create a negative vacuum and you inhale air into the lungs, it's going to take the line of least resistance. And if that mask is not flush on your face, air will naturally want to travel around the mask, behind the mask, and get inside. But when you're talking, when you have a mask on, it lowers the velocity and the momentum of your particles, and it doesn't travel very far. So if you and I are talking right now, you're giving me germs, and I'm giving my germs, and that's one good thing about the immunity. That's what I think we should share germs for immunity. But if you were to wear a mask, or I were to wear a mask, then you would get half or 10% of the amount of germs that come out of my mouth, especially sneezing or coughing, right, or whatever.
Because a lot of people just on a normal basis don't wash their hands when they leave the bathroom, and they don't cover their mouth. One of the things my mom always taught me was, if you cough, cover your mouth. Maybe not with your hand anymore, right, because then you would infect other things around you, but at least into your shoulder or something like that could be effective way to keep that. Now I know that again, my name is Jeff Carlson. I'm here with my good friend, Dr. Dennis Bassetti. We're talking about COVID-19 and the effects on our community and some general knowledge based on his years of expertise as pulmonary specialist. We appreciate all of you attending. We're going to post the video up onto our Facebook page when we're done so that you can see it. And we're going to try and do this every Monday morning, Coffee with Carlson. So I know that in the beginning of this, when it first started to come about, I asked my parents, who are, my father's in his 80s, immunocompromised. He really needed to be at home. So I sent him home just to try and keep him from getting anything. That was probably a good idea, you think?
Yeah, I think so. I think, one thing interesting about this is that it kills people who are older that rather than younger. I don't think we've had any deaths in Florida. I've got a graph. I can't remember it exactly. I'm going to do a Facebook post on it. But we haven't had any deaths less than 30 or 40 in the state of Florida.
Years of age.
Yeah. And I think, I'm glad the governor is allowing us to come out and start our economy again. I think probably that a better approach might have been, it's easy to retroactively figure this out, would be to allow to follow the Swedish model. I know that the Swedish government received a lot of flack from our government and other governments about the risks, but when you look at their mortality rate is only up a little bit, and they're going to have herd immunity within a month or two. And because we do all these social distancing things, it's interesting, the people who die are in the retirement age, and the people who don't die are in the working age. So we've shut down all the stores, the salons, the bars, or whatever, were mostly frequented by people who work.
Right.
So I think probably that we need to, and I sent the governor a letter, he didn't respond, but I think we
Surprise.
should. Yeah. I think we should open up, all the businesses, just wear a mask, wash your hands, and let our economy revitalize, and just sequester the older people, let them come out, let them wear a mask, wash your hands. You don't want to leave someone inside a house all day, because there's a lot of psychological issues that can occur.
One of the big things that really hasn't been talked a lot about, but we're starting to see some more numbers, are the mental health issues related to depression and suicide, just general anxiety of people staying at home. And I think you're right. That could be it could probably be a big impact.
You know, I read one study I want to share with you, and I can't remember where I read it, because I read like 400 studies. It was a couple of weeks ago, where the chance that a child would die or suffer medical complications is due to the lack of funds coming into the family, the lack of nutrition medical care, not because of the virus.
Wow.
So 10 times, even not 10, maybe 5 times the risk for economic reasons, economic harm to a young person rather than this darn virus. Kids don't die from this. I mean, there have been 1 or 2 kids that have died, which is a tragedy and a shame. But you know, I think in the state of Florida we haven't had any. So.
Well, the interesting thing about the last few months is that Dr. Bassetti practices and is on the front line, and we thank you for your service, just like we thank all of the frontline workers, nurses, doctors, MAs, receptionists, firefighters, EMTs, everyone that's out on the front line. We really thank you all for your service.
It's my pleasure, but it's also my responsibility. You know, I take it that way.
That he's got a completely, one of the reasons I wanted Dr. Bassetti to come on the first show is because he has a completely different perspective. For the last couple of months, my office, we're a small accounting office, we've been working on the business side of this and watching the business effects of it, of the shutdown. And you're right, that the effects of it have been broad and far reaching. And one of the things that scares me is that the longer we wait to open up, even on an incremental basis, I think we're taking those steps now to get things back open on a little bit more basis. I think we'll start seeing some of the salons downtown start filling up later this afternoon. So if you want to get in there, you might want to get an appointment quickly.
Are you saying my hair doesn't look nice?
No, probably mine, although we can't see it anymore. We can just see one of our participants' names. I'm not sure we can't see ourselves anymore.
You know, it's kind of human nature to be critical. You know, I catch myself thinking things like that periodically. And our government, you know, our national government and our state governments, they're making decisions the best they can, you know, based on what they know. And there's always 2 sides to a coin and different opinions or whatever. And I'm sorry, I was distracted by a car. Anyway, so, you know.
They just wanted to stop and wave.
Yeah.
We've got fans.
I think they shook their fist at us. Anyway, I think you know, I think the choices they could have made retrospectively should have been different. I think that they shouldn't have shut down the economy. Maybe New York, yes, because they have a catastrophically high, but in all the smaller counties, it should have been on the basis of county-wide risk, not necessarily one size fits all. So I'm being critical of either national or state government. But now that we know that, now we need herd immunity. Every other virus that we have immunity from, polio, diphtheria, or whatever, we have herd immunity.
Well, one of the surprising things to me is that it was okay during the shutdown to go to Walmart that's packed with people, but you couldn't go to church or to the hair salon. And these places are just as crowded with as many people. So you're right. I think it's a good point that leaders at all levels make the decisions they can at the time they're making them with the most available information that they have. Hindsight's always 20/20, so we can second guess that. But at the time, they were told these numbers were going to be way higher than they actually turned out to be. So based on that information, everyone probably want to pause and think that we might need to take a different direction or be a little bit more careful than not. And certainly, if you took no action, then the opposite effect happens. If we really did have 1 million deaths in the United States, what would have happened if we hadn't shut down some of the travel restrictions and things like that on an early basis? So we'll be Monday morning quarterbacking that for years.
Of course, yeah. Yeah. You know, most of the mortality rates in older people, and most of the mortality rate is in people who have multiple comorbid problems. And 50 or 68% of the deaths occur in nursing homes. Where you have people which are isolated and you know, they share the germs. It's a very tight-knit, small, kind of like New York, very small, densely packed area. And when you look at the mortality rate from this virus, I don't know what it's going to turn out to be, but it's probably going to be pretty close to that of the influenza virus, except for the fact that the influenza gets a younger population, and this gets an older population. The problem is that this is twice as communicable as the flu. So that's why.
Which means it's twice as likely to get it, or easy to spread?
Easier to spread. So therefore, if you have two diseases that kill at the equal percentage of people, but you have twice as many cases of the coronavirus, and you can have twice the fatality. So it's twice as serious. And just in the rough numbers, I don't know what the actual mortality is. That's just a guess on my part, but I don't think it's as high as is touted, because 40 or 50% of people who get the coronavirus don't know they have it,
Right.
and aren't tested. They did a study in Santa Clara County, 2 million population. This is done by Stanford, and 3,300 people were tested. And I think they detected twice the amount of people having the virus that weren't aware of it. So therefore, that would reduce the mortality rate by 50%.
Right.
When you correct for that. So
what do you think about? It's interesting. There's been a lot of articles about. It's funny, not funny, but it's strange that coronavirus came about, and a lot of other causes of death seem to have fallen off of the reporting chart. Has there been any change as to, because some of us in the general discussions around have thought, well, someone goes into the hospital and presents with a heart attack or cardiac arrest, and they test them for COVID, and then they pass away.
Yeah.
Do they die from COVID, or do they die from the heart condition?
Yeah, so the question is, do they die from COVID, or do they die with COVID?
Mm-hmm.
And that's kind of hard to tell. So I don't know. It's beyond me.
We don't know that, how they're reporting that. But interesting discussion that's going around in the community. So again, we're going to wrap this up. We've been on for about 30 minutes. We really appreciate Strangely Warmed Coffee Company. Wave at us, guys, for allowing us to come set up on their sidewalk in front of the shop. We haven't had any interesting people walk by or cyclists come by this morning, which we had when we did our first live stream. Again, my name is Jeff Carlson. I'm running for Highlands County Commission here in Highlands County. I'd appreciate you voting for me on August the 18th. Thank you for joining us, talking to my good friend, Dr. Bassetti. And Dr. Bassetti, if you wouldn't mind, I might have you back on the show at a later date. And instead of talking about something that is not necessarily a fun topic, maybe we can talk about music and your love of music. What do you think about that?
That'd be fun.
Yeah, I think it would be fun too.
Talk about classical liberal politics.
Classical liberal politics.
Yep.
We can do that too. We'll talk about whichever one you like. What we can do is we can play a good cop, bad cop, because I think you and I agree on some fiscal issues, but we might disagree on some other issues.
Yeah.
And the great thing about friends in politics is having lively, knowledgeable conversations and debates. The cool thing for us is that maybe we learn something from each other. That's why I've always liked debate with people, because I might take a counter position to what I actually believe, just so I can pull your point of view out a little bit more. Of anyone.
If you disagree, I'm not going to think you're a bad person. You have a different upbringing. You are who you are based on your entire life's experience, and me too, and therefore we come to different conclusions, and it doesn't mean that I'm right and you're wrong, vice versa. And it's a civil discourse that we need to have, nationwide.
Absolutely. I encourage everyone, if you want to find out more information about Dr. Bassetti's research and his knowledge, please like and follow his Facebook page, which is Dennis Bassetti and Associates, MDPA. You can find it through the search bar, and we'll share it when we post this recorded video up later. Once again, this has been Coffee with Carlson in downtown Sebring, right next to Strangely Warmed Coffee on South Ridgewood Drive. Thank you for joining us. We'll see you again next week.
Take care.